Hello, everyone, and welcome to my channel. It is Dr. Shani here, and today I'm going to give space and recognition to my role as a caregiver. And I'm going to share some helpful information with you if you are a caregiver or if you know someone who is a caregiver. I am what you call a millennial caregiver. And many millennials across the world are really in this unique position of taking care of their parents. Caregiving is not anything that is new, but we are in the day and age of social media. And so many more conversations are out there around caregiving, what it looks like, the challenges it comes with. And so today I want to talk about recognizing the signs of aging and also some of the things that you can do to be more productive in your experience as a caregiver. And so we'll go ahead and get started. Number one, pay attention to the signs of aging. Do not turn a blind eye to what you are seeing. You may be saying, well, what are the signs of aging? It could look like memory loss, falling, having an inability to get up, or being as agile or mobile as a person once was, hearing loss, being confused, being irritable, overly agitated, forgetting to take care of one's personal hygiene needs, like being kempt or combing their hair, being well groomed, washing clothes, forgetting to pay bills, getting where they parked. We all do that sometimes, but it's like I'm really getting lost. I don't know how to go down the street anymore or come back home, that type of forget. And if you notice these things in your parent or in the person you are providing care for, it could be your parents, it could be a neighbor, it could be, aging aunt, uncle. It could be grandparents, big mama, pawpaw, whoever it is. Bring these things to the attention of their doctor immediately. And you do so because you don't want to let these issues that you are seeing just hang out there and linger. That's how we start getting into crisis mode when we don't address these things that we are noticing early on. Sometimes it's hard to address these issues or to bring them or to verbalize it because it makes us really think, wow, I'm losing this person I love so much. But keep in mind, we are all aging and we will all have to leave this earth. And we don't know when and we don't know how that's going to happen. But if you are in a place where you're providing direct care, love, and support to someone you truly care about, you want to make sure that the doctor knows these things are going on so that you guys can craft a plan or put a plan in place for your aging loved one. Tip number two, or step number two, understand that the process of aging is a new experience for your loved one. Give them grace. Aging brings about its own set of physical, mental, emotional, and financial challenges. Your loved one may be accustomed to handling their affairs and their lives 100% by themselves. So, initially, when you are trying to bring your concerns to your loved one, they may, meet you with hostility. They may be defiant. They may be very passive aggressive with you, like, not answering the door when you come to their home to check on them. Understand they are behaving this way because it may be very hard for them to really give up this level of control that they have had over their lives. So give them grace. This is the time for you to be patient. And remember, your parents and your loved one, they truly still have the right to self determine what they do with their own lives. And self determination means they have a right to choose what they want to do. You cannot force an aging person or an elderly person to do anything. You can only suggest things to help them. Keep in mind, do your best, but it is still their life. Step or tip number three, establish a support system among your relatives and your neighbors. If you have siblings who are going to be a part of this support, love, and care process, you and your siblings need to be on the same page with your parents or your aging relative. It doesn't mean that you're always going to agree, but you have to at some point come to a consensus and say, this is what we're dealing with. This is what it is. We've consulted with the doctors, and now we need to put a plan in place. Sometimes dealing with issues around aging can be very challenging and very emotional for our loved ones. It's emotional for the person who is aging, but it's also emotional for the support system. Everyone doesn't react the same way or have the same level of response or training. And this is perfectly okay. What you want to start thinking about is who's going to take what role and what those roles are going to look like so that everyone functions as a team. So keep in mind, having that support system among siblings is going to be crucial to providing great care to your loved one, but also think about relatives who can help and neighbors. So, for example, if the grass needs to be cut and dad or mom just refuse to give up this responsibility, go out and contract someone to cut the grass for their home. If the house is unclean, contract someone to do that work. Contract someone to come in and do the cleaning. Sometimes, again, parents and loved ones may be resistant or hostile to this change, but understand it may take time to implement these things, but help them to see the benefit in getting some additional help and support. And so, if you can, work with other people, have them check in on your loved one. If you're not in the same town or community, have them check in, have someone go by the house. Make sure you put that support system in place, and keep in mind you want individuals who are going to be supportive. So you don't need family members and other people who are going to be overly judgmental, overly opinionated, because it is a change process and things are not perfect. You want individuals who are going to come in, who see what's going on, who are going to be encouraging to you, to demonstrate compassion to you, to your loved one, and really just not add stress to your plate. Because if you're entering into the role of being a caregiver, you do not need additional stress because you're already going to be stressed out with the amount of work that's coming your way, or even if you're already doing that work. Tip number 4, or step number 4, become your parent's health agent as early as possible. Start going to those doctor's appointments with your parents if you aren't doing so already. Discuss some of, again, the concerns you're noticing in your parents or your loved one with their doctor. They just may be outright opposed to creating a will. This is okay. Make sure, if you can, become their health agent and help them to understand why you need access to their medical records and why you need to communicate to their doctors on their behalf and make decisions on their behalf. Just say, hey, dad, mom, it's really going to be important for me to make this decision because, right now, your health is not in the best position. If something happens to you today, no one knows what your wishes are. And most older people, they're going to say, oh, well, I want my wishes honored and respected. So you kind of have to be very savvy in how you present information to people, especially if they are really resistant. So you kind of have to work through how you're navigating and using your language. Present it as a win-win for them. You also need to start thinking about asking those important questions. Loved one want to be resuscitated if something happens. Do they want to be put in an acute rehab or a long-term rehab? If you have not had these conversations with your parents and they are aging, they are displaying some of those signs that I mentioned early on, being forgetful, not knowing where they park, can't get back home. You really need to start having these critical conversations, because if you do not have the conversation and something happens, a crisis happens, let's say a health crisis happens, there's no health agent, there's no power of attorney in place. The doctors will make a recommendation to you, or if it gets down to the wire, they will make the decision on behalf of the patient. So think about end of life planning. I will make a separate video about that. Think about getting affairs in order for your parents early on. And if you can do nothing else, make sure you become their health agent. Tip number 5, or step number 5, give yourself grace and give yourself self-care. This morning, I cycled 14 miles on my Peloton. I do that because self-care is a part of my lifestyle. And all the times I'm not really good at it. When my school year gets really busy, sometimes I can't get on my bike like I want to. But when you are able to get self-care in, make sure you prioritize it. Caregiving is not a perfect process. It is exhausting, yet it is rewarding. You are able to demonstrate God's love to those who are in need. You are able to do for the least of these. I was in a grief session recently with a colleague, and she framed it. When you are caregiving and providing care, love, and support to someone else, you are really walking them home. It's the slow walk home for some people. Make sure you get your care in, because this slow walk home involves you taking care of financial affairs, you taking care of food, daily living needs for individuals, making sure they're clean, smelling good, and living with dignity. So to get your care in as you care for other people, you're going to need to set firm boundaries with those who are a part of your support system. Again, have a positive support system. You do not need people harassing you all day. You do not need people who simply don't understand, people who are calling and making your life more difficult. So this may look like you need to set boundaries with your family members. They may not understand these boundaries, but you need to take care of yourself. If loved ones are not able to assist when they come to visit, if their visit is just they want to sit up with the loved one and you're like, hey, this is not a vacation for me. I need you to come in and help. You need to limit those visits. So you have to think about ways that are going to lend themselves to helping you keep yourself in sound mind, body, and spirit. There's a tool on the internet that I learned about from others. I learned about it from my grief therapy as well. It's called Caring Bridge. You can provide updates to relatives and let them know how things are going if you choose to do that. And they may eliminate some of the need for that constant communication. But I do not believe in putting additional burdens on myself just to appease other people, especially as a caregiver. So keep this in mind. Take those long walks. Eat well. Try to get physical activity in. If you need a vacation, find a vacation place to go. If you need to contract some work in your home, hire a cleaner if you can afford it. Hire someone to bring food in. Use resources that are available to you to assist you during this period, because caregiving is not an easy process. And often those who are not caring for other people have the most opinions, and they don't even really know step one of providing care, love, and support to other people. They don't really understand that sometimes their opinions and their presence can be overwhelming or a hindrance to you having care and peace for your own life. Step 6, it's all about dignity, love, and respect. When your parents and loved one is going through the aging process, again, you are walking them home, as one of my colleagues put it. This may be a 1-month journey, a 5-year journey, or a 20-year journey. My mother, Cassie, and my aunt Constance provided primary care for their parents for over 20 years. At various points in my childhood, my paternal grandmother also lived with us. So I grew up learning a great deal about caregiving. And for me, it's about honoring my loved one, keeping them safe, keeping them in a place of peace without a lot of distractions and noise, and just allowing them to be in a place where they feel good every day, where they smell good, where they look good. And everyone doesn't have to know what that process looks like. Older people, as they age, their bodies begin to decline. They will start to experience frequent hospitalizations. They want to be loved, treated with dignity in life and in death. And most of all, they want their boundaries and their personal wishes respected in the end. At least this has been my experience. If you are a caregiver, I salute you for your big heart. It takes empathy, compassion, understanding to care for your loved ones. The Bible says, when you have done it to the least of these, you have done it unto me. Days will get hard on your journey. They will get lonely. You will cry. You will feel anger, and you will feel sorrow. But God is with you. He is teaching you something about yourself. He is helping your love expand and grow so much bigger. And believe it or not, and you may not see it now, but that blessing will come right back to you. I'm a living witness. I saw what my dad did for his mother and his father, and it's his father. I heard about that. I saw what my mom did for both her parents and what my dad did to assist his in-laws, and those blessings have come right back to my parents in their older age. Be a blessing to other people if you can. You may not be directly involved in the day-to-day care. That may not be your role, but also don't be a hindrance to the people who are providing that love, care, and support. Be a blessing. Be positive, because caregiving is extremely hard and you cannot judge other people until you have walked 1 mile in their shoes. Be a